Well, my story really began with Massey asking me if I'd be interested in literally helping to create and implement a brand new College of Health. And this is the kind of opportunity, frankly, that probably comes along once in a decade. You know, to be able to create something of magnitude in a world-class institution, in an institution that clearly recognized the opportunities and was willing to put in massive resources into the area to make it one of the best on the planet. What's not to like about that? I'm Paul MacDonald, and I have the absolute privilege of serving as the Pro-Vice Chancellor for the College of Health at Massey. I've had the privilege of working all over the world in various countries, and one of the things that really attracted me about New Zealand was it's the perfect size. It enables us to have population-level studies, but the level of bureaucracy, for example, is so easy to deal with. You know, I worked in Canada for something like 30-odd years and met the Prime Minister on a couple of occasions professionally. Here I was in the country 4 weeks and had the opportunity to meet and interact with the Prime Minister. So there's all kinds of access to influential people, so it means that the research that I have been able to undertake, you're able to put it in practice. You're able to tell the right people in the right time. I got into health for a very simple reason. My father passed away from cancer at age 45. And I saw what our family went through, and it was very clear to me that it shouldn't have happened. That there were ways of thinking about his care, thinking about the whole prevention of cancer and so many more other issues that we can and have to change. And so I was sort of really driven by that notion that it's possible for us to make a difference, and as an academic to work through our students and to engage them in a way that they're excited to change the world in really positive ways. One of the things I love about Massey is that it's a strategic organization. It thinks strategically, and we've made a real commitment to making a difference in the world. We're not just interested in describing problems, we want to solve problems, and we want to solve the big problems, the things that are going to make our world a better place. There are a series of huge disruptive forces that are about to impact on health and healthcare. Everything from increased levels of chronic illness, the rise of infectious disease, problems with nutrition security. This university is ideally positioned to figure out what we do and how we respond to them in constructive ways. Not just in New Zealand, but then how we take the very best of what we come up with in New Zealand and export that literally around the globe. It's an incredibly connected and well-networked place. Picking up the phone and having a conversation with major media outlets, and they'll respond to you. Just after arriving, they had an idea about how we could reduce tobacco use, and came up with the notion of just putting little rings on cigarettes to tell people how many minutes of life lost with each cigarette. After talking with just one reporter, by the end of the day, it literally was in multiple studios right across the country, and the story had been picked up and it went global. That's the kind of responsiveness, the level of connectedness that exists in this country and that you have access to as a member of the Massey staff. And we have people who are dedicated to helping the academics to locate specific media sources, influencers, funders, etc. And then they connect the academic staff directly with those individuals to make the most of your ideas, to make the most of your talent. My wife and I had visited New Zealand on a previous occasion. We knew the spectacular lifestyle that existed here. We knew how easy it would be to fit in culturally, that Kiwis are so open to other individuals. They understand different cultures, different perspectives. They go out of their way to make you feel welcome.